talk about a brain injury called DAI, diffuse axonal injury. Diffuse axonal injury. So what does this mean? Well, a lot of times in traumatic brain injured patients, we talk about subarachnoid hemorrhage, subdural hemorrhage, a contusion, if you will, or an epidural. So aside from this and this, these two have actual like mass lesions or blood products that our neurosurgery colleagues can go after and evacuate and really help the patient out if they have brain compression from that, meaning a midline shift. And a midline shift greater than 5 is when we are extremely concerned. But diffuse axonal injury is a little bit different. And so all of these things, we always get CT first. However, if I have a patient whose Glasgow Coma score, their GCS, is not improving, and they're still concussed after 24, 48 hours, I really like to go to an MRI on these patients because that's where you're really going to see that DAI picture. And on a patient with DAI, they have like this kind of that's why it's called diffuse. They have these diffuse punctate hemorrhages that are pathognomonic and classic for a diffuse axonal injury. And in our trauma grading, this is a grade 5 injury, which then carries an ISS of 25 because you square the AIS injury grade. And so again, this carries heavy weight. So patients with an ISS of 15 or more are critically injured. So with just that injury alone, your ISS is 25. But again, definitely think about an MRI in those patients that aren't waking up and had a very high velocity injury, because this tends to happen in that like whiplash shearing type injury. And it's tricky because again, there's no real thing to go after from a surgical standpoint. So we just have to treat the edema and the swelling typically with hyperosmolar therapy and go from there.